If we think about babies born with congenital heart problems, the incidence is about 2% of the population, so 2 in 100. When we look more closely at those children, we can find a genetic cause in about a third of them. There likely are genetic causes for more individuals, but at our current level of understanding, if we send blood testing for a genetic analysis, we'll find an answer about a third of the time. Over time, we'll discover more genes that cause heart issues in children, and likely that number will go up. For any given genetic diagnosis, there's always a range of outcomes, and that's because in addition to the specific genetic change that's causing the heart problems, children have a lot of other genetic information that they've inherited from their parents. And it's those interactions between the genetic change that's causing the heart problem and the rest of their genetics that we think is influencing the severity of the presentation. Sometimes very specific changes are more predictive of a more significant or a more mild presentation. And we understand that from looking at dozens and dozens of children with the same genetic changes and seeing that they tend to be either more significantly or less significantly affected.
Any new diagnosis of a genetic condition affecting the heart brings significant medical and psychological issues, and we really feel our purpose and our role is to address all of those holistically for the patient. That means ensuring the patient understands the condition they have, and we spend a lot of time making sure that patients really know about the genetic, molecular, and the clinical basis of the diagnosis, but also how that affects patients psychologically. So we have a psychologist on our team who we think is a really key component to helping patients adjust to a new normal and to be able to live the life to the fullest, despite having a new diagnosis thrown upon them, often unexpectedly.
Our team includes a psychologist, as well as a group of social workers and child life specialists. During your visit, and depending on your diagnosis, we will recommend different support groups. There actually are different foundations that have been developed for patients and their families. At your visit, we'll let you know how to reach out to these foundations for support.
Our mantra is very much to allow those who wish to continue participating in sport to do so. We just have to make sure that all parties, and that's the family, ourselves, and coaches and schools, are in agreement, and that everything is done safely. So in the worst case scenario where a complication may occur, everyone is aware and primed and knows exactly what to do. But for the vast majority of individuals, they go back to sport safely, they enjoy it, and they reap all the benefits that sport and being part of a team provides.
Cardiac screening depends on family history, your diagnosis, and different signs and symptoms you're experiencing. Sometimes with a new diagnosis, our team will follow up with you every few months. Other patients might require cardiac screening every 12 to 18 months. Our team will inform you at your visit on our recommendations for cardiac screening. At your visit, our team will have a detailed discussion on your diagnosis, how it was caused, what it means, and how to manage it in a way that fits your life.
So we think that overall holistic approach is really key to getting the patients back to the quality of life that they want and being able to achieve all the things in life that they want to achieve.